two main types of prostate cancer treatment. There's surgery and then there's radiation. And there's a lot of different combinations and different ways to do radiation, such as cyberknife and broad beam and all sorts of ways to deal with it. But inevitably, the nerves that are around the outside of the prostate will often end up damaged from whatever treatment that is. And the job of those nerves is to send a message to your brain to tell your penis to get erect. And so that stops happening when those nerves are damaged. And in a lot of cases, if you have surgery, those nerves are just damaged for a short period of time and they will heal themselves. With radiation, it's usually a bit of a different story, and you have a downward trend of those nerves, which you also have with age. And so because this happens to most men 50 and above, they're already having that change. But what we often don't think about is how having erectile function is really important to a man's masculinity. And I think for a lot of women, it's really hard to understand that. And the way we think about that is that if a 50-year-old woman who's never going to breastfeed a baby again found out she had to have a double mastectomy, for instance, that would really affect her feeling of herself as a feminine woman. And I think having a penis that is functioning and do it what it's always done is really connected to a man and their masculinity. It's not all about sex, not all about having penetration or having, pleasure's important, obviously, but it's not all about that. It's about your self-esteem and knowing who you are. And I always think that if you had a arm that was paralysed, you wouldn't just leave it hanging there. You would want to fix it and you would want to deal with it. And I don't really understand why our sexual function is any different. I think the particularly difficult thing with a cancer diagnosis, and this is the same for women who have had breast cancer, is that I think people feel as though, and the research reflects this, that they should be so grateful that they recovered from cancer and that they're still alive, that everything else should be insignificant. But that's not true because, medical advances have become so great now that 96 to 98% of men survive prostate cancer and a large percentage of women who have breast cancer survive. But the treatment changes their intimate relationships. And I think what we need to focus on now that we're good at getting rid of these cancers and treating them, is making sure that if you're going to live for another 20, 30, 40 years, that your quality of life is there. And people shouldn't feel guilty that they want both, because we should be entitled to that. And, even the World Health Organization says that having a healthy sexual relationship and intimate life is as important as shelter, water and food. So I think if it's good enough for the World Health Organization, then it's certainly good enough for the rest of us to pay attention to what's going on here and not just cure cancer, but give people good quality of life.